Raise your hand if you understand why sleep apnea patients wake up at night to use the bathroom. So you've got an obstruction in your airway. Okay, we'll just signal it like that. Something is going on, can't get the air in the way you would expect. Well, in your chest cavity, you have a bunch of blood vessels. In particular, you have like the inferior vena cava, and it's trying to move blood back into the heart. Well, this chest cavity has a pressure. If you were choking right now, and you tried to breathe in, but no air was coming, what do you think happens to the pressure in the chest cavity?
Increases?
Increases, right. Now, technically, it has a weird convention in pulmonary medicine. It says increasingly negative intrathoracic pressure, okay? So that's what that is, and it amounts to, and you can feel it, right? You feel that in your chest wall. That increased pressure pushes on the venous system, and it pushes blood more rapidly back into the heart, all right? Now, if this is a heart muscle cell in the right atrium, where this blood is coming back, what does this cell look like several hours later when it's been doing this all night long? Because this is happening all night. This is not just like one apnea. This is a sequence of you're struggling to breathe all night long. This heart muscle cell is going to look like this, meaning what? It has become distended because it's received either a faster or larger volume of blood than it's used to receiving under the so-called circumstances of normal breathing. Okay? So if it is distended, the heart has various sensors that have to monitor whether or not there is something called fluid overload. And the heart has built-in sensors that does not want to have fluid overload because that's a danger to the heart. This, in fact, is what's called a false fluid overload signal, and it's false, of course, because there was no increase of fluid into the body. It's just rapidly sending the fluid to the heart. So the same amount of fluid is in the body, but it's going to the heart so fast, the right atrium distends. The right atrium thinks, I must have a fluid overloaded state here. I better do something about it. So what does it do? It releases into the body a peptide known as ANP. And ANP comes from the atrium, so it's called atrial natriuretic peptide. And of course, you got the hint here. This peptide is a diuretic. It's the body's own diuretic. It goes to the kidneys. The kidneys make more fluid, urine output, into the bladder. Depending upon your own sensitivities, prostate problems, bladder problems, age, and so forth, even the amount of water you might drink at night, at bedtime, your bladder will hold so much. And once it goes beyond a certain threshold, you're likely to wake up and use the bathroom in the middle of the night. I also believe, although this is an earlier theory that people say has been disproven, but I still think there's a relevance to it, I believe this pressure also does something to descend down into the pelvic region and actually create more pressure on the bladder. That used to be one of the original theories as to why people wake up at night to urinate. I still think there's some validity to that, but I don't know how you prove that. This is the one that's the most common pathophysiological mechanism that has been described. So what do? Reverse all this, put somebody on PAP therapy. You reverse the whole cycle. There's no buildup in pressure, no increased venous return, no distension of the right atrium, no false fluid overload signal, no release of ANP to the kidneys, no increase in urinary output. You put people on PAP therapy, between 50 and 80% of the people no longer get up at night to urinate, just completely eliminated. And the part that's so interesting about that is that if you look at urology journals, when they're talking about this problem of nocturia, they are talking about the concept of reduction. They're talking about reduction of events. In the sleep literature, You can talk about the elimination of events. So you've had a surgical procedure or you've taken a certain pill. You'll read about it in a urology journal, and there's now this reduction in the number of times that you go to the bathroom. But in the sleep journals, you will hear them say something like, and 50% of the people no longer went to the bathroom. So it's a pretty remarkable, pathophysiology.